although I was contemplating for a long time yesterday whether or not I should tell them that I have been in contact with someone confirmed COVID-19. But in the end, I still tell them because my dad actually told me that you do not hide anything from me. And it's the same, if my parents have anything back home, I also want them to tell me what they are facing, the difficulties.
27-year-old Tan Chern Yan hails from Johor. He is a first-year trainee doctor specializing in pediatrics. He's currently working on the front lines of the COVID-19 at a hospital in Manchester, United Kingdom. Tan takes care of patients under the age of 16 who are suspected and confirmed cases of the virus.
And actually, during one of my on-call shifts, I had my first experience seeing a few suspected COVID-19 cases. They came in with complex medical background and needs, and they were admitted with symptoms of increasing shortness of breath and temperature. They needed high amount of oxygen support, and during my shift, I have to review them, and I was asked to put a new cannula for one of the patients, and the swab for some of the patients came back as positive for COVID-19 the next day.
Wearing the personal protective equipment or PPE for long hours can be very uncomfortable.
It was okay when you first put on a PPE, but because you are in a very highly pressured environment, especially when you try to put a cannula and you need to try to find a vein and the patient was coughing at the same time, you do feel quite warm and humid as time goes on. I think probably about 15-20 minutes, I really want to adjust the surgical mask, but I know I can't touch my hair and touch my body, so I just need to keep going and make sure that I complete it as soon as possible.
Tan works 8 hours on a normal shift, but due to a surge in COVID-19 cases, the hospital has to adjust the rota.
Well, you might be put on separate emergency rota to accommodate the potential influx of more patients with suspected cases of COVID, which means that you might need to work longer hours, which is 9 a.m. to 9 p.m. As the hospital is expecting a surge in clinical areas such as critical care, acute medicine, and the emergency department, considerations have been made to redeploy medical staff from other departments to areas where more medical staff is needed. This sudden switch caused some initial challenges. The staff might have been fully used to their own department for quite some time. In fact, some of the hospitals, as I mentioned earlier, in London have recruited all the junior doctor trainee to the front line to help out.
Healthcare workers are at high risk of contracting the virus. Just like anyone else, Tan is worried about getting infected.
And to be very honest with you, after being in touch with those patients with confirmed cases, I do start to think, especially when I came home after my shift, if I have a slight cough or feeling slightly out of breath, is it possible for me to contract those virus? But I think the main thing is you need to tell yourself that you have chosen this career and you need to boost up your immunity basically, just to make sure that I have a good work-life balance and get enough rest if I could, and to eat a healthy lifestyle basically.
Being far away from home is also not easy, and Tan has a choice to leave, but he chooses to soldier on alongside other frontliners.
Actually, one of my uncles said to my dad that why don't you ask him to take annual leave and come back? And I just laughed to that because it is not as easy as leaving all the responsibility and the duties here and just to fly back. And if you go, who is going to take care of patients, since you have the responsibility on them?
Tan knows his family in Johor worries about him, so he tries to keep in touch with them as much as he can. His ways of telling them that he is okay.
Oh, just like pasta and normal stuff. But are you prepped for dinner?
Once the situation gets better, he wants to go back to his family and reward himself with good Malaysian food.
Especially the street food and the char kway teow, especially the mamak basically. As after my night shift or on-call shift, you just want something quick and convenient, and that's not something easily available here. The street food or even hawker center, the food is something that you will miss. No matter who you are, where you are, Malaysian food is still the best.